reports on our website. We're standing by for the Prime Minister's update on the government's response to the COVID-19 crisis. He'll be speaking at any moment, 11 o'clock Eastern. We're expecting an update on the government's procurement of PPE, personal protective equipment, including things like, of course, ventilators, masks, gowns, gloves, hand sanitizer. Specifically, how much of what was ordered about 2 months ago has actually arrived and how that domestic supply chain has ramped up. For instance, we know that of the 29,000 ventilators ordered, just over 200 have been delivered, but we know that the domestic supply chain for those ventilators is expected to be online soon, and thousands more are expected in the next number of weeks. So we're going to hear more about that from the Prime Minister, and perhaps more questions too about ongoing challenges with testing, specifically in the province of Ontario. I should note that Quebec met its testing goal for the first time yesterday. So that's some encouraging news for that province. While we wait, I'll bring in my colleagues, the host of Power and Politics, Vashi Kapelus, and the CBC's David Cochrane. May not have very long, depending on how timely the Prime Minister is today, but we are expecting him to talk a little bit about the PPE situation. Vashi.
Yeah, I think this is a highly anticipated update as far as procurement goes, only because we are in the process right now, and what we've been discussing over the past week and a half or so is the reopening of provincial economies. As those economies reopen, there is not only the continued demand in the healthcare system for personal protective equipment, but outside of the healthcare system as well. And there have been issues with procurement so far. For example, with N95 masks, that would be in the healthcare system. We know we haven't reached capacity, that the measures that everyone took worked, and that the hospital capacity wasn't overloaded. But there are problems with procuring masks that are up to Canadian standards, for example, from China. The majority that have arrived, and that's still far short of the majority that were originally ordered, were not up to Canadian standards. Then there's sort of the domestic front, as you mentioned. There's also the provinces' roles. Provinces are procuring a lot of this equipment as well. So it's difficult to get a sense, I think, of where we stand. At least I've found it confusing so far. How do we have enough? How much might we need for the second wave, the potential of a second wave? And what about in the meantime, as economies reopen? What is the sort of overall need? Are we meeting it? What do we need to do so? And as I said, it's the sort of federal component, and it's the provincial component, and then it's also the domestic supply chain, which of course kicked off when the pandemic started as well. The government focused its efforts on the domestic supply chain, ramping it up, trying to be able to meet demand domestically. But I'm not sure where that process stands right now, because it does seem like getting certified or making sure they're up to standard. That's a long process. It's not something that happens overnight.
Yeah, no, and if you look at the figures from last week versus this week, I'll just give you a couple of examples where we've seen really no change. So gloves, there hasn't been more. N95 respirators, as you point out, problematic. And the ventilators, although we have heard from Flavio Volpe, who says that those are online to come in the thousands very, very soon. David, you've been talking to people, and I know also about the role the provinces play versus the federal government, and then everybody, you know, who has a business who now wants some of these things, not the medical grade things, but the other things that are there.
Well, a couple of things to keep in mind. The numbers you're going to hear from the Prime Minister it's a minority of the procurement that is happening in this country. In normal non-pandemic times, 100% of this is done by the provinces, with the exception of the emergency national stockpiles that the Public Health Agency maintains. So what the federal government is doing is trying to backstop and supplement that, because obviously the usage rates and the burn rates of the disposable equipment like gloves and masks is just through the roof during this pandemic. So we've seen low numbers of ventilators delivered to the federal government, but it was always going to be May or June before the domestic capacity ramped up to the point. And even companies like Thornhill Medical, which have been tasked to provide some of these, they had told us they were going to deliver their ventilators to Ontario first, because the Ontario government was also a big customer of theirs in this preparation for the pandemic. The other thing on the N95s, there have been problems with quality for the masks that are coming from China. A huge percentage of a federal shipment was found not to be up to first world standards.
9.8 million. 9.8 million.
Exactly. Yeah. So those have been used or are being used in areas that do not require an N95 standard, sort of as a surgical mask replacement or a supplement. But the provinces, it's important to point out, have their own supply lines, largely with 3M in the United States. So they have a consistent supply coming in. Now, whether it's enough or a surplus, that's unclear, but there is a steady supply of masks up to the standard they're looking for coming from the United States. This is why that exemption that President Trump granted Canada a month or so back, was so critical, because if the N95s from the United States were getting stopped at the Canada-US border, there would be a full-blown PPE crisis in the Canadian health system because of what is happening with the Chinese supply. So right now, N95s seem to be okay, I guess is the phrase that I would use. The concern is if you get into a second wave in the fall, and you get a massive surge coming into your hospitals, then this is where these surplus ventilators may be required, but also where the N95 quality issues from China become an acute problem. Because if you can't rely on the big bulk orders from China, then once you get them to a warehouse in Hamilton or Montreal, wherever, and start looking at them, realize they're not up to snuff, that's where you're going to have a real issue. So Medicom is a company that they've tasked to be part of the domestic supply chain. It's an N95 manufacturer, but it's still weeks away, if not a month or more away, from being able to produce N95s at the shop it's setting up in Montreal. They're essentially repatriating a production line, setting up a whole new N95 production line in Canada. That takes time. You got to get all the machinery here and get it going and get everybody trained and get it up and running. So that part of the domestic supply chain is still a ways away, but the good manufacturers to the south in the U.S., they've been a vital part of this, and that's provincial procurement, not federal.
Well, a couple of things. We are going to talk to Logistic Unicore, which is one of the Canadian companies that is now making gowns, and I know that gowns are highly coveted right now too, so we'll talk to them in a little bit about how that is going and how they're ramping up their part of the domestic supply chain. But as we point out, the provinces who have procured PPE on their own, directly for their own healthcare systems, some are doing very well. Alberta, for instance, has not only sent PPE to other provinces and ventilators to other provinces, but it is now allowing private companies, to buy PPE from the province because they have enough, and obviously businesses, as they start to reopen, need more of it. It does make me worry a little bit after hearing someone, one of the top doctors at the WHO, Vashi, say today or yesterday, at the end of the day yesterday, that the second peak could actually come in the first wave. So some of this was about preparing for the second wave, but if there are so many unknowns around the virus and there's a potential that things would get worse much faster than we anticipated, obviously the need for a large amount of PPE very quickly becomes more urgent.
Yeah, and I think what we've learned over the past 2 months is you kind of have to plan for the worst case scenario, because that wasn't the case in most provinces and federally, at least when it comes to, for example, the emergency stockpile for PPE when it comes to the first wave or the potential sort of first part of this pandemic. In the example that you provided of Alberta, it's almost an interesting test case, and it's a little bit wonky, but the way in which healthcare is delivered, or the administration of healthcare in Alberta, it went through, I think, at least a decade ago, a sort of controversial process where it was all centralized. And this was, of course, a discussion in Ontario as well as some other provinces. And while at the time that was a very controversial move because it affected the delivery of health care throughout the province, when it comes to procurement, it ended up being a huge benefit to Alberta because it was centralized, because they only had basically one office working on the idea of what they might need. They started a lot earlier than other provinces, and as a result, even now, you mentioned the ventilators, they loaned, I think, over 20 to Quebec. They seem to have enough supplies that they had a surplus at a certain point. But you're right. When it comes to the second wave, that might be an even bigger concern for provinces. You have seen over the past month far less outcry from premiers, for example, compared to the first month of this pandemic, where they were ultra worried about even healthcare workers having enough PPE. That we were hearing at a time from Quebec there was only 7 days left, that kind of thing. So it looks like on the procurement side for provinces, things have stabilized at least. I don't know what that means for the second wave. When it comes to the federal picture, and David is absolutely right, this is almost like a backstop for the provincial supply. I think there are some worrying trends, and you pointed out the N95 respirators. Of the 104 million that the federal government have ordered, despite what's happening with the United States from China, just less than 12 million have arrived, and 9.8 million, as you pointed out, Rosie, of those 12 don't actually meet our standards. So there are big issues with China. The Minister of Procurement has talked about them, how it's kind of like a Wild West out there. I think the bigger issue is even the small portion we're getting are not up to our standards. So if that sort of unpredictable relationship with the United States were to be affected again, I mean, that is a concern going forward, especially when you talk about the potential for a second wave or subsequent smaller waves thereafter. This isn't something that's going to stop overnight. And so the need, and I think the concerns around China will remain for a while as well.
Okay, and we are expecting the Prime Minister in about a minute's time, so we'll just stay on his front door as we wait for him to come out and talk more about PPE. I will also just bring you up to date on the state here in Ontario, because we've talked a lot about in the past week or so about how cases in this province seem to be on an upward trend. They still are, but reports today say they are at 287 coronavirus cases, which is the lowest number in more than a month. So, it might be a one-off, given that we know the trend is heading in some worrying directions, but good at least to see that the numbers are a little bit lower today. And of course it happens as the Premier has made the decision, along with public health officials, to encourage more and more people to get tested. Even if you don't have symptoms, you can show up at some of those COVID-19 assessment centers and get tested to see if perhaps you're one of those asymptomatic carriers. There's 129 of those assessment centers across Ontario. So as Ontario tries to get a handle really on what is a worrying trend and ramp up testing, as I mentioned right off the top, Quebec has finally met its target of 14,000 daily tests in that province. So first time that it's done that, but also some encouraging news as everyone tries to ramp up more. Here now, the Prime Minister of Canada.
Good morning, everyone.
Over the last few weeks, our women and men in uniform have been working to help the most vulnerable Canadians as we deal with this pandemic. And as the need for their help continues, we've received new requests to extend this period of deployment in both Ontario and Quebec, and we will be following up. Members of the Canadian Armed Forces are doing an incredible job, just like always. They are serving with distinction for our grandparents, our parents, our elders. In Ontario, they've made some extremely troubling observations about several long-term care facilities in which they've been serving, and we have shared this information with the provincial government. As I've said many times, we need to do a better job of caring for the people who built this country. The greatest generation saw us through World War II, and we need to be there to support them properly through this global crisis. I spoke with Premier Ford on this earlier this morning to let him know that, of course, we would be there to help as he takes action on improving care for seniors in long-term care centres. Our government will continue to support Ontarians through this, and I know this is something the Premier will be addressing in greater detail at his press conference later today. This morning, I also wanted to provide an update on personal protective equipment. In the last 10 weeks alone, over 40 flights have arrived in Canada carrying much-needed PPE. This represents hundreds of thousands of items, everything from masks to hospital gowns, that we've shipped to our frontline workers. At the same time, we're also investing in production here at home. And on that front, today, we're taking yet another critical step forward. I can announce that we've signed a contract with General Motors to produce 10 million face masks. As we speak, GM employees are already making these masks. They will keep people safe and help slow the spread of COVID-19. And for the auto workers in Oshawa, this contract will support good, well-paying jobs in an industry that's faced tough times. On testing, we're also making progress. We're supporting companies and research centers across the country as they develop new, improved COVID-19 test kits and products. And for life-saving healthcare equipment, we've signed a new contract for 10,000 ventilators that are being produced through a partnership between Canadian Nobel laureate Dr. Art MacDonald, his team, and Vexos. Deliveries will begin this summer, bringing our total of made-in-Canada ventilators to 40,000. On this and on other supplies for frontline workers, I know that Minister Baines and Minister Anand will have more details to share a little later today.
In the last 10 weeks, more than 40 flights carrying personal protective equipment have arrived in Canada. We're talking about hundreds of thousands of different items, including hospital gowns and masks that have been distributed to our frontline workers. At the same time, we are working with companies right across this country to ramp up our domestic capacity to produce these articles here in Canada. Today, I'm able to announce that we have signed a contract with General Motors to produce 10 million face masks. At this point, GM employees have already begun to do that work, and the first batch of masks will soon be available. With respect to testing, we are also making progress. Right across the country, we are supporting companies and research centers that are designing new test kits for COVID-19. And we're doing the same thing on ventilators. We have signed a contract to produce 10,000 ventilators that will be made through a partnership between Art McDonald, his team, and the company Vexos.
Over the past 2 months, we've rolled out targeted support for sectors that have been hit hard by COVID-19. And we know that more needs to be done. Just look at the food industry. With the growing season underway, farmers are working harder than ever to keep Canadians fed. But because of COVID-19, many are having trouble finding workers. So today, I can announce that our government is funding up to 700 youth jobs in that industry. This will support the people who put food on our plates while creating new opportunities for young people. This builds on what we've already done, from connecting more Canadians of every age with work in the sector to supporting seasonal workers.
At this time of year, farmers are working harder than ever to feed Canadians. But because of COVID-19, a number of employers are having a lot of trouble finding workers to help them out. So we will be funding up to 700 youth jobs in that sector. That will help out those who feed our families, while at the same time creating opportunities for students this summer.
In the last weeks, Canadians have been focused on our families and on our neighbours, on our communities and our country. But we've also been closely engaged with how the world is managing COVID-19, not only because the only way to truly end this virus in Canada is to end it everywhere, but because as a trading nation, with Canadians who trace their origins to every corner of the planet, we understand better than most how connected the world has become. Canadian jobs and businesses depend on stable and productive economies in other countries, so it matters to us how everyone weathers this storm. For so many, this pandemic is devastating. More than 300 million people around the world will be out of work, and more than 30 million people will be pushed into extreme poverty. We can't wait for others to act. It's not in our self-interest, and it's just not who we are. We can and we must seize the opportunity to do what we can to make people safer and more prosperous, to create an international system that recognizes who's left behind and strives to lift them up. This is no small task, but I know we're up to it. Canada is ready to do our part as we help bring the world together in the fight against COVID-19. On Thursday, I will be convening a high-level meeting with the Secretary General of the UN and the Prime Minister of Jamaica to consider global economic challenges and how to better support developing countries. We're bringing together leaders from every region of the world, as well as the heads of international institutions, to work on shared strategies to protect the global economy, support our citizens, and help the most vulnerable. I've been speaking to many leaders about these issues and about the importance of global cooperation. This includes Chancellor Merkel of Germany and President Macron of France just yesterday, and leaders from the Caribbean and from across Africa, Latin America, and the Pacific. And key international financial experts like Canada's own Mark Carney are getting involved too. To address this pandemic, to keep people safe, to help our economies weather the storm, we need to collaborate. And with this forum, Canada will be there to help lead the way forward. Canada
is a trading nation with trading links with many countries around the world. Our workers, our economies, our businesses depend on a global economy that is healthy. And in the midst of a pandemic, we cannot close our eyes to the world we live in. We must not forget the most vulnerable, whether they're people who live in remote regions or people in the Caribbean. For many of them, the pandemic has been a disaster. As Canadians, we know that we have a role to play. We can and we must build a safer and more prosperous world for everyone and ensure that our international system is fairer and more equal for all. This is quite a task, but I know we are up to it. On Thursday, I will be convening a high-level meeting with the Secretary General of the UN and the Prime Minister of Jamaica to address the current challenges and look at various ways of helping developing countries. This will be an opportunity for leaders to get together and develop strategies to protect the global economy, support our citizens, and help the most vulnerable. I discussed those matters and the importance of international cooperation with a number of leaders. Yesterday, I spoke to Chancellor Merkel of Germany and President Macron of France, and I've also had discussions with leaders from the Caribbean, Latin America, and the Pacific region. And of course, key financial experts as well, such as the Canadian Mark Carney. They will also be participating. If we all work together and we remain focused on what we must do, I know we will be able to get through this together and come back strong afterwards. Thank you.
We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. For questions, star 1. Première question, Raymond Filion, TVA. À vous.
Good morning, Prime Minister. First of all, about the military. You talked about extending their mission, but you didn't say until when. Do you know how long that mission will be extended? Well, it's only in recent days. Yesterday from Quebec, for example, we received a request for an extension, so we have to have some discussions with the two provinces, but of course we will be there to help them.
We just received the requests for assistance in the past days, including only yesterday for Quebec. So we will be following up with the Premier's offices, but of course we will continue to help.
Right, and suivi?
Follow up? Are there other asylum workers working in long care homes? Now, is your government prepared to process their applications quickly, as many are asking? Well, for a number of weeks now, the Minister of Immigration has been working on that specific issue. We know that there are some extraordinary people doing heroic work in our long-term care facilities, and we must look at how we can help them, and that's precisely what we're doing now.
Merci. Prochaine question. Operator.
Thank you. Merci. Next question, Mia Rabson, the Canadian Press. Line open.
Good morning. I'm just curious if you can explain to us what the difference is between the special COVID-19 committee being safe to sit in Parliament if you don't think it's safe for the full House of Commons to sit in reduced numbers.
I think it's been important that we've had a parliament and a democracy that has continued to function. Over the past number of weeks, we've had 3 days a week of sessions where the opposition can bring forward their questions, make their suggestions, and demonstrate to all Canadians that our institutions continue to function. We know that continuing that approach now 4 days a week will be important to continue to respond to this extraordinary challenge of our time. We are, however, continuing to work on the issue of voting. Before we move forward on voting, we want to try and make sure as much as possible that we are able to bring in remote voting. I know that the PROC Committee of Parliament is studying that carefully. I think it'd be important to ensure that Canadians across the country have an ability to make their voices and their decisions heard in Parliament through that process. That continues to be something that we're working on.
And a follow-up?
Yeah, I'm also curious, given that you had a known exposure to COVID-19 early on, when the serological testing becomes available, do you plan to get one?
Yes, I do. I think serological testing is an important part of understanding exactly how COVID-19 has been present in the country, including in people who haven't displayed any symptoms at all. And as soon as those tests become more largely available to Canadians, I will certainly ensure that I'm one of them.
I think it is important to know to what extent COVID-19 has spread among our population, including among people who are unsymptomatic, including possibly myself. So when those tests will be more widely available, I intend to become tested.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir, à vous.
Oui, bonjour, Monsieur Trudeau.
Good morning,
J'aimerais
Mr.
revenir.
Trudeau. I'd like to come back to the asylum seekers issue. I'd just like to know, do you agree with the principle of regularizing the status of certain individuals or expediting the processing of their application or even putting them in the immigrant process, as Quebec seems to be requesting? Well, for quite some time now, we've realized that people coming into this country make a strong contribution to our protection and our success as a country. Our government has always been open to immigration and has always appreciated the people who come into this country. When it comes to asylum seekers who came into the country through irregular means and are now working in our long-term care homes and are doing heroic work to protect Canadians, we are currently looking at how we can recognize that work and expedite the process. And the Minister of Immigration is working precisely on that. I know that there has been a change of position on the part of Ms. Freeland. A week ago, she was saying we are a country that abides by the rule of law. We have to use the regular processes. But now it seems like you're prepared to do things somewhat differently. Well, we are in a situation that is quite exceptional and unprecedented. COVID-19 is demanding that we review certain ways of doing things, and that includes our immigration system. Now, that system is focused on abiding by the regular processes and treating everyone fairly, and it's important to follow those processes. But in an exceptional situation, we can, of course, consider exceptions.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Oui, bonjour, merci beaucoup.
Good morning. Thank you very much. Now, on immigrants, Mr. Trudeau, how many irregular asylum seekers do you think have been coming in? And I understand you agree with the principle, but what are the problems that could surround securing their status? Well, I think people recognize that heroes who are doing exceptional work in a very difficult situation should be recognized as such. And we have an immigration system that is robust and rigorous and complex. Therefore, the Minister of Immigration is currently looking very carefully at what this kind of approach would involve, and we understand that people feel there's a need to thank those individuals, but we also want to make sure it's done properly. Follow-up? Yes, as a follow-up, Mr. Trudeau, on another issue, the wage subsidy, the leader of the Bloc Québécois has been suggesting that you are not being a moral leader on that issue. He doesn't understand how you could be asking for the wage subsidy. And as the leader of your party, will you demand that your party not to use that wage subsidy, or will you go ahead with it? The wage subsidy was introduced to help all organizations, all businesses that have seen a decline in their revenue in order to help the workers. The subsidy does not judge the type of work or the type of business or organization that is involved. We simply look at how we can help people who rely on that job to keep their paycheck and to be able to support their family and buy their groceries. Now, in political parties, there are people who work as translators, as accountants, as receptionists. These are people who do important work for themselves and for their families. And we created the wage subsidy to help precisely these kinds of people to help to keep their jobs rather than being laid off, possibly because of a decline in the organization's revenue. Christian Noël, Radio-Canada. At the beginning of your speech, you referred to the soldiers working in the long-term cares that have made some troubling observations. Is that only in Ontario or also in Quebec? And what are we talking about? Distress, negligence? Could you be more specific about those troubling observations? And how did you feel about that when you heard this? Well, I read the report yesterday coming from the Canadian Armed Forces, and I can tell you that it was extremely troubling. I got that. We sent that report to the Government of Ontario over the weekend, and we will be discussing that further, and we will be there to help. But there is no doubt that we must do much better when it comes to supporting our seniors in these long-term care homes right across the country. That report talks specifically about the situation in Ontario, but we continue to be vigilant across the country.
I read the report in full yesterday. We shared it with the provincial government of Ontario over the weekend. It is deeply disturbing. There are things in there that are extremely troubling, and we need to take action. And I spoke with the Premier this morning to assure him that, of course, the federal government would be there to support them as they deal with this situation. We need to do a better job of taking care of our elders in long-term care facilities in Ontario and indeed right across the country. The Premier will be sharing this report with Canadians in the coming hours and will be speaking at more length on it, and I will leave that for him.
Now, without going into detail, because you don't want to scoop the Premier of Ontario, what bothered you the most in that report? And in terms of your own emotions, were you sad? Were you disgusted? Were you shocked? How did you respond? Well, the answer is yes. I was sad. I was shocked. I was disappointed. I was angry. I believe that we're talking about a situation that clearly is a reality associated with COVID-19, but has also existed for quite some time now. And we must, as a country, improve the situation in those care homes, but I will allow Premier Ford to comment more on this. But as I've said several times since the beginning of this pandemic, these are our seniors who are suffering the most as a result of COVID, and we have to do better to support them. And the federal government will be there to take part in any discussions that will take place now and in the future to improve that support for the people who built this country.
On reading the deeply disturbing report, I had obviously a range of emotions of anger, of sadness, of frustration, of grief. It is extremely troubling, and as I've said from the very beginning of this, we need to do a better job of supporting our seniors in long-term care right across the country through this pandemic and beyond. This is a situation that has gone on for a long time. We need to take action as a country. The federal government will be there to support provinces in their jurisdictions on dealing with this as we move forward.
Tom Perry with CBC. You've read this report. Are you concerned that the problems that it reveals are not limited only to Ontario? And what specifically can the federal government do right now to deal with these issues?
the federal government is there to help. We have stepped up with members of the Canadian Armed Forces in a number of long-term care facilities across the province and indeed across Ontario and Quebec. But the challenges faced by this system of long-term cares is larger than just the places that the Canadian Armed Forces are showing up in. So we need to have a conversation and we need to take action as a country on improving care. There are many extraordinary, excellent long-term care facilities across this country. There are some that obviously are not doing as well, that we need to make sure we are improving the standards of care and the support for Canadians as they retire, as they reach that phase of their lives. The federal government, as I've said from the beginning, will be part of the conversations with the provinces on how we move forward, how we learn from this crisis and what we've learned through this crisis, and move forward.
We are facing a situation that clearly has existed since long before the pandemic in a number of long-term care homes, where we're seeing that the support given our seniors is not up to scratch. And of course, there are seniors' residences and centers that are extraordinary in terms of the way they care for our seniors, our elders. However, there are other facilities that do not meet our standards. And as I said right from the outset, as a society and as a country, we have to work together to improve the care we provide to our seniors. The federal government will be there to support the provinces in that work.
I could ask you about PPEs. You're talking about the flights that have arrived, but where are we running into bottlenecks? What's preventing us from getting even more of this equipment?
I think there are global challenges around provision of PPE. We have demonstrated with 40 flights and hundreds of thousands of items, many in the millions, that we have received and distributed across the country, that we are providing for Canadians as we need to. But at the same time, we recognize that as the economy reopens, as perhaps a second wave might hit us, we need to be ready. And that's why we continue to draw on even more PPE. We continue to go through stringent and rigorous quality control, because we have seen a rise in counterfeit products and products that don't meet rigorous Canadian standards. We have ensured that every item that has been distributed in Canada has met our standards. But it's why we've also moved towards increasing and creating domestic production for PPE. And Canadians stepping up to help Canadians is what this country is all about. And we're going to continue to do the work necessary to ensure that right across the country we have the PPE necessary to move forward safely.
From the very beginning, we have been working to ensure that personal protective equipment is distributed right across this country, that it is of high quality, and we continue to receive items from countries around the world. But at the same time, we are creating local domestic production here, because we know that as the economy reopens, we will need even more PPE, and we have to be ready for a second potential wave. And we will be ready, because that's what we're working towards as a country.
Was it the findings related to the conditions that people are living in long-term care homes, or did it rise, in your view, to the level of abuse? And in either case, what would you say to people in Ontario whose family members are in these homes right now, when they're hearing you talk about this? What should they do?
As I said, the report that we received, we passed along immediately to Ontario. We are working with them on the next steps, but I will leave it to Premier Ford to share that report and discuss the next steps in a couple of hours when he moves forward for his press conference.
As you know, tomorrow we're expecting a decision on Meng Wanzhou's extradition, and this is going to upset people on one side or the other, either the Chinese or the Americans. I'm wondering what level of interaction there's been between your government and your counterparts on the Chinese side and the American side preparing for one of those two possible outcomes. Are you concerned, and have you spoken to them about the possibility of retaliation if it doesn't go their way?
We have continued to engage diplomatically with our partners, both with the Americans and the Chinese, on the issue of Meng Wanzhou and indeed of the two Michaels who've been arbitrarily detained in China. But one of the good things about having a truly independent justice system is that we don't need to apologize or explain for the decisions taken by our independent justice system. We have confidence in that system, in its independence, and we, of course, will continue to abide and defend our system.
Of course, there is constant diplomacy between Canada, the United States, and China on various issues, including the Canadians detained in China. But one of the advantages of a fully independent judicial system is that we don't have to explain or make excuses for our system. We have confidence in the judgment that comes out of that system and the approach taken by people in our independent judicial system. And that's a major advantage we have in Canada.
Minister Janet Silver, Global News. Just to follow up on extending the military's mission in long-term care facilities and the horrible conditions the report showed that they have found, Public Safety Minister Bill Blair received a letter back on May 14th outlining these allegations of abuse and neglect. Do you know why the minister and his office would have sat on this letter for 10 days before acting?
When we received this report, we shared it with Ontario. I found out the existence of this report on Friday afternoon. On the weekend, we shared it with Ontario. I read the report yesterday, and it is being made public today. These are things that we needed to move quickly on. These are things that we need to take action on. And as I said, the federal government will be there to support Ontario and other provinces as they move forward.
And just to switch gears a bit, one of your Vancouver MPs has a WeChat group she uses to communicate with Canadians. She has publicly advertised on this group and invited people to join, so it's kind of like a Facebook page, if you will. And she's allowed the group to be used to appeal to Canadians to donate to a lawsuit against a Global News journalist for a story that they don't like. The MP I'm talking about is your Digital Minister for Government, Ms. Joyce Maury. Her mandate letter calls for her to work with the media in, quote, a professional manner. So I'm just wondering why you're allowing this minister and her staff to use the web presence to fundraise on a lawsuit against a journalist.
This is the first I hear of this situation, and we'll be following up. This is the first time I've heard about this situation, and we will be following up. Thank you all.
And that is the Prime Minister of Canada with his daily briefing to the country today, actually with some pretty shocking developments that we will hear more about. First at a technical briefing by the Ontario government at 12:30, and then a full release by the Premier at 1:30 Eastern. I'll bring in my colleagues Vashi and David to talk more about reports that the Prime Minister said Canadian forces saw in Ontario long-term care centres that he called extremely disturbing. I know both of you have been working your sources to find out more about what might be in this report and how this unfolded. I'll start with you, Vashi.
Okay, so it sounds like from the Prime Minister, and I should reiterate what he said, as you mentioned, Rosie, he said he experienced anger, frustration, and grief when reading the military report on what's going on in some Ontario long-term care facilities. We know that the military is in 5 of those facilities, most of them located within the Greater Toronto area. I'm just pulling up the exact list. Orchard Villa in Pickering, and one in Scarborough, Etobicoke, North York, and Brampton. And what I'm told is that, and you heard the Prime Minister talk about it, he is in receipt of the report as of Friday, but there was a question from Global News that Bill Blair's office, the Minister of Public Safety, might have had the report since May the 14th. I'm working to try and confirm that at this point. What I've heard from 2 separate sources in the military is that this report asks the province to investigate and take some sort of action, corrective action. They found evidence of few rules being followed, a lack of staff training, a lack of medical equipment, inadequate resources overall, people passing away and not adequately being taken care of. My source says that there are some specific examples provided in the report, and we are anticipating, according to the Premier's office, the full report to be released in a few hours' time. There's a technical briefing about the contents of it about 12:30 Eastern. Bottom line, though, the military witnessed some awful things in the short time they've been in these long-term care homes. We know as well from the Prime Minister that the provinces of both Ontario and Quebec have requested an extension of the presence of the Canadian Armed Forces in long-term care homes in the province. He says he's considering that extension right now. My guess is that it will be granted given the issues that persist in those homes. But essentially what you have here are the military acting as whistleblowers about what's going on in these homes. We know from speaking with people who have relatives, who have loved ones in them, that there are major problems. We know from the spread of the virus, the sheer data, that these homes have been hit particularly hard. But it appears what the military has witnessed in the homes is so awful, so troubling, as the Prime Minister put it, that they've put it down in writing and that they are asking the province of Ontario to take corrective action as a result.
Okay, just a couple reminders about the state of Canada's military in these long-term care centres. As Vashi, as you said, 5 of them in Ontario, and we don't know where these incidents occurred, but there are 250 members of the military working in those 5 centres in Ontario. There are 25 long-term care centres in Quebec that have the additional support of the military, 1,350 soldiers working inside those care centres, and we have heard, of course, some very troubling stories out of Quebec as well, even before the military arrived. The difference here, David, as Vashi rightly points out, is that the military working there was concerned enough to flag this up, report this up, so that the province could take steps. And we'll see what those steps are, but certainly sounds at very least like some form of negligence.
Yeah, you have a remarkable situation, Rosie, where the Canadian Armed Forces are essentially acting as whistleblowers in terms of what they've seen in these 5 long-term care homes, or some of these 5 long-term care homes in Ontario. We have noticed now from Doug Ford's press secretary, Ivana Yelich, that they will be releasing the full Canadian Armed Forces report on the 5 long-term care homes the military has been insisting at 1:30 today. There is hang on, just getting a bit of information here.
Yeah.
Okay, the May 14th date that some of this has come out apparently was a letter maybe that was sent to Bill Blair, or an alert, but I'm told by a senior government official that they did not get the full report from the military until Friday, and that's when it was shared with Ontario over the weekend. So it's come very quickly from when the formal report was compiled and sent to the Prime Minister's office, from when it was read, shared with the Premier's office, and then made public. It is unclear, to me at least, what may have been known by Minister Blair's office on the 14th of May, whether that was a letter sent from someone in the community, from a member of the military, or simply part of a news report, because there have been various reports about deficiencies found in long-term care homes. Sure. But this goes back to the conversation we've been having throughout this whole thing, Rosie, of just how this is the big lesson from the COVID-19 story in Canada, is how vulnerable our seniors are and how neglected they have been in terms of stopping the virus from getting in there, containing its spread once it happened, protecting the staff who work there, providing them with a living wage so that they can reduce their exposure by working in multiple homes just to cobble together enough of an income to stay solvent in regular times, let alone during a pandemic. But now to have the military deployed to sort of fill in the gaps that were laid bare by these outbreaks and by staff in these long-term care homes getting sick, and to have the military walk into something that is so troubling, and soldiers see some things, it was so troubling they felt to formally make a complaint and send a whistleblower's report directly to the Prime Minister of Canada, is a startling thing in what has been a series of startling things over the last several months. So this is, I think what we're going to hear from the Premier in about an hour and a half is going to be pretty horrible.
Yeah, and I should point out that there is a technical briefing which is not, will not be made public, so we can't televise it, but our reporters will be calling in, of course, to get background information on that technical briefing. The Premier Ford will be with the Attorney General, if that's any indication of the seriousness of this matter, when he speaks to the entire report, which will be made public. I'm sure people will be revealed, will be reassured, to see the fullness of that that report. The Minister of Long-Term Care will also be at that press conference at 1:30. We'll, of course, bring that to you live. I will just say that the Prime Minister did seem, a little, he obviously was frustrated and upset about it. He also said that he offered his support to Ontario as the country really is going to have to move forward with a difficult conversation. And clearly these soldiers were brought into these long-term care centers because they were some of the most vulnerable and the centers that needed the most help. But whatever these Canadian Forces members have seen, obviously upsetting enough for them to report it up to their superiors. We've talked to a couple of them and didn't get a sense of this, but we will get more information through the afternoon. I'm going to let you two work your. Oh, David has some more information.
Yeah, Rosie.
Yep.
I just I was asking about this 14th, about a letter apparently Bill Blair received, and what I'm being told is that Bill Blair, and this is from a government official, did not have anything on the 14th. There's a package that was delivered on Friday, and in that package, one of the documents is dated May the 14th.
Okay.
So it's something that has been compiled over a period of time. So there may be documents that were dated this time and shared at certain levels,
Sure.
but what we're being told from officials in the Prime Minister's office is Blair did not have anything on the 14th of May. The package that arrived had documents dated on the 14th of May. That may contradict some other reporting. I'm not putting one up against the other, but this is what we're being told in our inquiries.
I'll let both of you work your sources for a moment, if we don't mind, as we wait for the federal briefing from federal cabinet ministers and public health officials, which starts at noon. In the meantime, I'm going to try and bring in a guest, Colin Furness, who you may recognize is an infection control epidemiologist and assistant professor at the University of Toronto, and joins me now. Hello, good to see you.
Hello.
I say recognize you because all the epidemiologists in this country have become sort of famous now and well-known faces to us, and we appreciate you making time. I know it's not your field of expertise, but maybe I'll just get you to weigh in on these revelations that we don't know very much about at this stage, that soldiers have witnessed some troubling things inside long-term care centers. Certainly we knew that this was a situation that was going to have to be corrected going forward. Just your thoughts on what you heard there from the Prime Minister.
Well, we know how to keep people safe. We know we have this expertise. We do it in hospitals all the time. And, I'm sure the Prime Minister was shocked to get that report. I'm sure we're all shocked. On the other hand, I think we kind of know that marginalized populations and old folks are one, prisoners are another, homeless are another. We don't spend the money that we need to spend in order to have them at the standard that we know we can do and that we do in acute care hospitals.
Okay, let's talk more particularly about the situation in Ontario, which I know a lot of people are sort of looking at it and not understanding why the trend line is not good right now, is frankly troubling. What should we take from that?
Well, there's two pieces I think we need to sort out. The first is the regulatory framework that is applied to long-term care homes adequate? Are the regulations adequate? That's number one. And then number two, given those regulations, is the enforcement, is the compliance and the enforcement adequate? And I think that may take an inquiry to actually sort out, really try and differentiate those.
In the broader term, though, in terms of how Ontario is doing, we're still not doing great. Today it was the lowest number we've had in a month, 286 cases, but over time, over I think 13, 14 days now we're at of having still a high number of cases. What are your concerns there?
Well, we can't read too much into the daily ups and downs. There's noise there. You'll notice if you look carefully that we tend to have fewer cases on weekends than weekdays, and that's not virus takes weekends off. So there's workflow issues there. We have to take a long view. In other words, you really need to look at sort of a 2, 3, 4 week pattern. I see in the model that I maintain that we are almost exactly perfectly treading water. We are making zero progress at this point. It's not actually really getting worse. But we are making zero progress. So we are in the middle of a wave. We're past the peak, and it is continuing and in a very fixed way.
Okay, so that all of that, again, that doesn't sound great at all. And we are still reopening. I mean, there's no urgency to the next stage of reopening, but we are still doing certain things. Do you think that is happening too quickly, given that?
Well, where there's community spread, such as in Toronto, for example, there's no question it's too early, and our chief medical officer of health said so. His standard was he wanted to see fewer than 200 cases a day. I think that was too high. I think you would want to see lower still, and that was overruled. And not only that, we opened everywhere at once. That doesn't make sense to me. There are parts of the province where there is very little community spread, where I think that would be fine to do. But certainly in Toronto, in urban areas, we shouldn't be doing it.
Yeah, they don't seem at all interested in that idea. The many times, for instance, my colleague Mike Crawley has asked the Premier, whether it be Northern Ontario, which is in a very different situation, even in Ottawa, not the same situation as Toronto and Peel. Why do you think there's such a reluctance to make it a little bit different, given that it's a different picture across the province?
It feels like the need to control, central control, because as soon as you have different regions, you need to devolve a certain amount of responsibility, say to the local public health units to say, enforce this different way of doing things. But Ontario is vast. I mean, it's vast in population and it's vast in territory. It's absurd to me that one set of rules should apply given the variability that we have.
What do you think about the increase in testing now, the attempt to really ramp up testing in this province, meaning that people who don't have symptoms can now show up to a testing centre? How important is that? And should that have been done sooner?
Well, it's about 2 months later than it ought to have been, and I think there's been a lot of illness and death that was avoidable that's happened, but we're still not using the right strategy. So we're obsessed with increasing the number of tests, and we do need to do that. But we actually have to stop being reactive. Setting up assessment centers is great, but we need to go where the risk is. We need to recognize there's occupational risk, and we need mobile units to go to workplaces like grocery stores, like taxi garages, where there are workers who have a lot of exposure to the public, and we need to do that testing proactively. Not sit back and wait for people to find their way, but to go out and look for the infections.
Yeah, it does seem as though, too, there seems to be a lot of mixed messaging from, either the Premier or the public health officials. It's all very complicated, and I wonder if people can even understand what they're actually supposed to be doing, because it's not always clear to me, frankly.
The discourse ought to be on testing strategy rather than just the number of tests. Obviously, they're related, but I think the right testing strategy would require something maybe like 10 times the capacity we have right now. So the trick is you need to figure out your strategy first. It needs to be a proactive strategy, and then you can start talking about capacity and the number of tests. So I really feel like the discourse has been kind of backwards.
Okay, Colin Furness in Toronto, thank you so much. We've been really seeking some expertise on this issue to help us understand. Appreciate your time very much, sir.
My pleasure.
He's an infection control epidemiologist and assistant professor at the University of Toronto. Okay, we're going to take a short break as we wait for the federal briefing, but of course, awaiting more news from the province of Ontario on these troubling news that soldiers have spotted some incidents of concern in some of the 5 long-term care centres where they're working. We'll be right back after this. The Prime Minister said the military has compiled a report that he calls deeply disturbing about some of the conditions they found in some seniors' residences in Ontario. Observations that he says provoked feelings of anger, frustration, and grief for the Prime Minister. The Premier, Doug Ford, is expected to share details from that report at 1:30 Eastern. At 12:30 Eastern, there will be a briefing for the media on some of the details inside that report. We know that there are 250 soldiers working in 5 long-term care centres in this country. Let me show you a little bit more of what the Prime Minister had to say just moments ago.
We've received new requests to extend this period of deployment in both Ontario and Quebec, and we will be following up. Members of the Canadian Armed Forces are doing an incredible job, just like always. They are serving with distinction for our grandparents, our parents, our elders. In Ontario, they've made some extremely troubling observations about several long-term care facilities in which they've been serving, and we have shared this information with the provincial government. As I've said many times, we need to do a better job of caring for the people who built this country. The greatest generation saw us through World War II, and we need to be there to support them properly through this global crisis.
Okay, and as we await, of course, for that full report to be released, the Premier's office says it will be, and for the Premier and others to take questions about what actions they will take now that these observations have been made by Canadian forces and this report delivered to the federal government and then to the province. I'll bring in my colleagues, the host of Power and Politics, Vashi Kapelis, and the CBC's David Cochrane. Both of them have been on the phone or emailing to try and get more information from their sources about what we might hear that does appear to be extremely disturbing at the very least. I'm going to start with David this time and then over to Vashi.
Yeah, Rosie, we have some information. Credit where credit is due. This was first reported by Global News by Mercedes Stevenson and Stuart Bell, 2 of our colleagues. Mercedes works here with us in Ottawa. Verified the information with a government source who has seen the reports that was sent to the military. What they found, soldiers in some of these homes were cockroaches, flies and rotten food, residents left in soiled diapers. Some residents had not been bathed in weeks. No separation between infected patients and uninfected residents in a room with just a curtain between them, which is a violation of all of the health protocols that we have been told on how to isolate people and to stop them from getting sick. So you had essentially a failure not only of medical protocol, an alleged failure of it, but of basic sanitary issues of people not being bathed for weeks and sitting for days and hours in soiled diapers. We have seen similar reports like this in some of the more troubled homes in Quebec, for example, where the government was forced to go in and take control before Quebec became the first province to sort of signal the need for military intervention there, and the military is in 25 homes. In Quebec, only 5 in Ontario, but the specifics of cockroaches and people in dirty diapers for hours and not being bathed for weeks. All of that witnessed by Canadian soldiers and deemed to be serious enough that they wrote it up in a report that was sent to the Prime Minister's office on Friday and will be made public in a little over an hour by the Premier of Ontario, Doug Ford.
Okay, Vashi, you too have learned some details about what we might hear later.
Yeah, the thing that keeps being underscored to me is that there is a reason that the military put it in writing, that everything that David just described, and I would add to that one other example I was provided with, the reuse of syringes on seniors. Essentially what they saw, and it didn't take them long to observe it, was so troubling to them that they wanted to make sure it was in writing, that it was presented in a report, because they are, their primary concern, at least as is being relayed to me, is that something is done about it and quickly. I think this does increase the pressure that had already been mounting on the Ford government to look more closely at what is happening, to conduct what the opposition had been asking for was a full public inquiry. They had announced, I think it was last week, that they would set up a commission, but there was still criticism from the opposition that that didn't go far enough. I think that this report, and based on what David is reporting and the information that I have, instances of neglect, no rules, a lack of staff training, a lack of medical equipment, as well as members witnessing people dying and they were not being taken care of adequately. adequately. I think when that is all laid out before the province, that pressure to conduct some sort of public inquiry, something with an accountability mechanism built in, is going to increase. There's no doubt about it. I'm already hearing from people who have family members, some in these 5 specific long-term care homes, but outside of them as well, who are, disturbed just to hear how disturbed the Prime Minister was reading this report. They are very worried, of course, because of the conditions around COVID-19. Many of them most of them can't go in to visit their loved ones. And as a result, this is sort of heightening their concern around the conditions in which their loved ones are living. Again, though, I think the primary thing that's being conveyed to me is there's a reason this is in writing. The military, and my understanding is it's in all of the homes. Like there's at least some reports of this to varying degrees, but that in all 5 homes something was witnessed. The reason that they put it in writing is because of how troubled they are and that they want something done about it. So there's a lot of emphasis being put on that to me.
Well, that would also indicate some liability issues too, frankly, to protect the military. And if this gets to a point where there is legal measures that need to be taken, then that would definitely shore that up. Go ahead, David. Sorry.
Yeah, Rosie, I'm also being told that according to someone who has seen the report, the whistleblower report is what I'm going to call it, from the military to the government, is that seniors with COVID were allowed to roam throughout the facility in some cases. We know it's a challenge to stop COVID from getting into the facility and then contain it, but allowing infected seniors to roam is a problem. And also workers going from infected to non-affected rooms wearing the same gowns and gloves that they had just been using to treat someone who had maybe have been infected. So that obviously then becomes a vector for transmission inside a long-term care home where the population is extremely vulnerable and where the overwhelming majority of the deaths in this country have been. There's also been issues with fungal infections in some patients from a lack of proper hygiene. I'm not going to give you the specifics on that because it's daytime television, and also expired drugs being found inside the facility. So all of these are allegations and findings by the military contained in this report that will be made public later today by the Premier of Ontario.
So, I mean, certainly there are allegations, but there are observations by Canadian Forces members, which obviously gives them a certain amount of weight, undoubtedly, and will force, I think, the government to respond in a serious manner when the Premier comes out at 1:30. I just remind people, too, that today the Quebec Ombudsman, sort of the citizen ombudsman, said that she was going to launch an inquiry into the state of affairs at long-term care centres in Quebec. She says that she's very concerned at how many people there have been treated. Of course, the situation much bigger in Quebec. There are 25 long-term care centres where more than 1,300 soldiers have been sent. There have not been these kinds of observations that we know of made by soldiers in these long-term care centres by Canadian Forces members, but we do know some of the things that both of you are detailing here. We first saw back at the Heron Residence long-term care centre in Montreal, where many of the patients, residents I should say, because this is where people live, were being mistreated, and workers at that center basically abandoned their posts for fear of getting COVID, concerns about their own safety, and because they weren't being paid adequately. So many of those people were just left, and it sounds like many of the same kinds of conditions. As we wait for this federal briefing, which will give us an update on the Ottawa response, obviously I think the concern here now shifts to the Prime Minister has talked many times about the conversation that needs to happen moving forward, and the federal government will be part of it. I know we've talked before about even the possibility that long-term care centres somehow get folded into federal jurisdiction under the Canada Health Act, but I wonder now if the urgency for an actual inquiry that could even be directed by the federal government isn't more real and more urgent, because if we're moving now into a different phase of this, anticipating a second wave, I don't know that we can sit around and wait to figure out how to make some pretty massive changes to long-term care centres across the country, because of course it has been primarily in Quebec, some in Ontario, but there's nothing to say that this couldn't happen in other places. Vashi.
Yeah, I think that's an excellent point. I think, and I actually think that is the gist of the point that was made to the provincial government in Ontario last week, can you really wait around for a commission? And the Premier's response was, well, a commission might be faster than an inquiry. I know it sounds like semantics right now, but I do think the bottom line is I don't think you can wait till the pandemic is over 2 years from now to investigate what happened and make changes. It's apparent just from the details that have emerged based on what the Canadian Forces is alleging, based on what they're saying they observed. This is something that needs to change immediately. And so I think that will be the gist of the questions to the Premier. You pointed out earlier, and I think it's important too, that the Prime Minister indicated, and every time he mentioned it, that the federal government will be there for Ontario. There are no specifics there. I mean, the federal government has not, for example, at this point said it will conduct an inquiry or it will conduct a commission. It has said it's open to one. There are questions, you rightly point out, about changing the jurisdiction. So far, premiers have widely resisted those. They want to keep themselves, they want to stay in charge of long-term care. They say that they know the system best and they know what people, or rather those homes, need best. They are open, of course, to looking into what went wrong, but they certainly don't want the federal government to take over jurisdiction. I think that the question, though, of what role does the federal government play now is less of a question for months from now or years from now. I think it's a question for today, based on what the Premier might say. You know, like if the Premier does need more resources in order to make these changes, and previous health ministers have indicated if you want a long-term care home to run like a hospital, it's going to cost a lot more money. If that is the case, does that money need to come from the federal government? I'd imagine so, given how the sort of financial challenges that provinces are facing right now, and to what end? We had talked earlier about the prospect of the federal government providing additional envelopes of money for long-term care and attaching strings to them, aka, you know, a set of standards that had to be met. In this case, clearly, the CAF is laying out how standards are not being met, right, and how troubling it is, and the sort of evidence of that. I think all of that becomes part of the discussion. But to your point, Rosie, it's not a discussion to be had in the future now. It feels very imminent, and it feels very important to be making those decisions right now, so that the situation can be rectified. And of course, my sources are telling me that the military's package, the letter today, the file today, will specifically ask for action to be taken.
Yes. Okay, David, you have more information too, and then we'll bring you the briefing.
Just quickly on that, I mean, from speaking with senior officials, what they say is that they believe the military compiled this so carefully and comprehensively as they did because of the possibility that some of this could be criminal liability issues. And we'll need to hear more from the Premier there. But an important piece of context, we talk about what the federal government can do. It's important to talk about what the provincial government has done or hasn't done. And I want to point people to reporting done by our colleagues David Common, Melissa Mancini, and Katie Peterson on the 15th of April, looking at resident quality inspections of Ontario's 626 long-term care homes. 2015, 16, 17, most of them got an in-person inspection. 2018, only a little more than half got an inspection. In 2019, last year, the year before the pandemic, only 9 of 626 long-term care homes received a resident quality inspection. I've tweeted that story out. It's important context for today. Great work done by David Common and his team in Toronto. Melissa Mancini and Katie Peterson have been leading our coverage on the long-term care issue throughout this.
Yeah, and it also shows you that there will be tough questions for provincial governments as well about choices they made around funding in long-term care centres and how they were addressing those. You can say that there wasn't enough money, and that may well be the case, but decisions were made, obviously, and these were choices made that the provincial governments will have to defend. I would just point out 2 other things before we go to the briefing, that the province has put 2 hospitals already in charge of long-term care centres, 2 long-term care centres in Ontario that weren't able to live up to what the measures were supposed to be. And although, as Vashi said earlier, there is now the promise of an independent commission into all of this, there was not the promise of an inquiry, which is something that Mike Crawley wrote about extensively as well, because there have been inquiries into many other cases that are deeply disturbing in this province, and perhaps this will now put some pressure on the government to move to a more formal inquiry, which would result in consequences. But again, not something that's something that would take some time. Obviously, we will expect some more immediate response from the government at 1:30. Let's go now, though, to the federal public health briefing, the government's response to COVID-19, and we have Dr. Theresa Tam, the Chief Public Health Officer, speaking now.
During the pandemic and beyond, I encourage all Canadians with an interest in improving the lives of people living with pain to share your ideas and experiences with the Canadian Pain Task Force. Thank you. Merci.
Okay, thank you, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New.
Now, Dr. Howard New, you have the floor. Thank you. Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 85,998 cases, including 6,566 deaths, and 44,911 people are now recovered. Labs across Canada have tested over 1,500,000 tests, and about 5% of these tested positive overall. Over the past week, we have been testing an average of 22,300 people daily. Though some sectors are starting activities, we have started thinking about the cases of Canadians dealing with chronic illnesses and the unique challenges they face during these unusual times. It will be more difficult for these people to find new ways of living with COVID-19. For some, their medical condition or the medications they take may place them at higher risk for severe illness due to COVID-19. These individuals and those who care for them will need to consider carefully how best to manage their illness while navigating the direct risk of COVID-19. Others may be struggling to access the health and social services they need to cope with the day-to-day realities of their illness. People may be anxious about accessing these services, even as they become more available in the coming weeks. Delaying care can lead to worse health outcomes. So I encourage Canadians to contact your care providers to learn about the in-person and virtual options available to meet your needs safely. Today, I also want to talk about children and adults who live with chronic pain, which affects 1 in 5 Canadians and is often invisible to others. We know that unmanaged pain can lead to decreased mobility, mental illness, problematic substance use, and even suicide. This is why it is so important to ensure access to pain care services and support, even during times of crisis. If you or someone you love needs help managing pain, please know that you are not alone. There are resources out there. The Canadian Pain Task Force, an advisory body set up by Health Canada, has compiled a list of resources on the Task Force website for Canadians living with pain during COVID-19. Until the end of this week, the Task Force is consulting Canadians through the letstalkhealth.ca portal to help the Government of Canada better understand and address the needs of people who live with pain during the pandemic and beyond. I encourage all Canadians with an interest in improving the lives of people living with pain to share your ideas and experiences with the Canadian Pain Task Force. Thank you.
Merci, Dr. No.
Thank you very much, Dr. No.
From our Minister of Public Services and Procurement, Anita Nant. Anita, please.
Thank you, Christia. Before I begin, I would like to thank the doctors, nurses, and caregivers, and all of those on the front lines for their tireless efforts in the battle against COVID-19. I would also like to thank our essential workers who have continued to keep our country functioning during this challenging period. Je pense notamment aux membres.
I'm thinking about members of our security forces, producers, retailers in the food sector, as well as all those who are transporting people and goods throughout the country.
Thank you all.
Thank you.
Turning to supplies for COVID-19 testing. As we enter a new phase in the pandemic and restrictions are slowly lifted, we know that testing will play an increasingly important role so that we are able to identify new cases across the country and track the efficacy of our efforts to protect public health.
I can assure you that our government is determined to support provinces and territories on this front, particularly by providing them with all that they need for testing, like reagents and swabs. As I stated before, because this is very important, a contract has been signed with the corporation Lumine Ultra in New Brunswick to produce reagents in quantities that could enable us carry out 500,000 tests per week up till March 2021.
Backstop, we have also placed large orders of reagent with 4 premier suppliers that work closely with provincial laboratories. These contracts will allow provinces and territories to access reagent and other lab products required for testing while we remain in negotiation with others. I am also pleased to report that last week 6 letters of interest were sent to 5 companies and post-secondary institutions to procure chemical agents for the domestic production of reagent. When it comes to swabs, we have ordered close to 12 million and have received over 3 million so far. The specific types of swabs necessary for COVID testing remain in very short supply globally. So we are working with domestic suppliers with capacity for 3D printing of swabs and with techniques for swab sterilization. In this process, we are collaborating closely with Minister Haidu and Health Canada in the area of rapid testing and serological testing to build a base supply as tests become approved and more widely available. Turning now to domestic supplies of PPE. In terms of overall domestic supply of PPE here at home, capacity is on the rise, and we are seeing tremendous ingenuity on the part of Canadians as they ramp up and retool production lines. I continue to work closely with Minister Baines on this front, and our efforts to date have resulted in 24 contracts with Canadian companies to help Canada in the fight against COVID-19. Today, as the Prime Minister mentioned, we are also proud to announce a contract with GM Canada. Under this contract, 10 million surgical masks and face coverings for Canadians will be produced here at home in Oshawa, Ontario, over the coming year. GM joins a growing list of companies right across the country who are using their manufacturing capabilities and skilled workforce to help shore up the supplies that Canada needs. Turning now to international procurement. While domestic production of all types of PPE ramps up, we must still continue to procure from abroad to meet our immediate needs. International supply chains are stretched across the board, with global demand for vital supplies continuing to accelerate. C'est maintenant à un rythme régulier que des changements
Cargo flights are now arriving the country regularly. Just last week, 7 cargo flights supplied more cargo to Canada, representing in total 42 cargo flights from China over the last 10 weeks. We now intend to resort to maritime transportation, considering the significant volume of PPEs that could be shipped.
In the past week alone, major shipments have arrived from our own chartered flights and from our suppliers. 2 of the biggest models of planes in the world delivered hundreds of thousands of medical gowns to Canada, bringing our weekly total of gowns received to more than 500,000 as part of 1.9 million overall. In addition, large sea containers of hand sanitizer are also en route, complementing the 5.2 million liters of hand sanitizer that we have received to date, the majority of which was produced right here at home by Fluid Energy out west and Irving Oil in Atlantic Canada. On N95s, we received hundreds of thousands of N95 respirators that this week passed testing and are now being distributed to the provinces. We have also received 7.6 million more surgical masks this week, bringing our aggregate total to more than 87 million surgical masks. Finally, in the past week alone, the number of gloves received has more than doubled, bringing our total to 31 million pairs, which we now know are in need in some of our provinces. In conclusion, with every order and every delivery, challenges remain to be overcome. At this point, we anticipate demand to continue to accelerate in Canada and around the world. It is for this reason that I must stress that while the numbers of deliveries are encouraging and we are definitely moving in the right direction, my message to my team is to be vigilant. We must keep going. That is precisely what our government intends to do. I want Canadians to know that we will remain steadfast in our efforts to send safe and effective supplies to our frontline healthcare workers as quickly as possible. Merci beaucoup. Thank you so much.
Okay, thank you, Anita. And now we will hear from our Minister of Innovation, Science and Industry by video, Navdeep Bains. Nav, please.
Thank you for giving me this opportunity to present an update on the mobilization of the industrial sector to fight COVID-19.
In this period of crisis, we've seen and continue to see Canadian companies across the country making tremendous contributions to our healthcare system.
To face the crisis, many people are getting together and adopting new tools and objectives to innovate like never before. Canadians can be very proud of this.
The speed at which companies are stepping up to the plate and the ingenuity and creativity they are bringing with them is incredible. Since we issued the call to action, over 6,300 companies have contacted us to offer their expertise and capacity, and of those, more than 700 have retooled to supply personal protective equipment.
We acted quickly to launch a call for action, analyzed letters of intent, and issued purchase orders.
Working with one of Canada's Nobel Prize-winning researchers, Dr. Art MacDonald, we've been able to finalize a purchase order of 10,000 ventilators. Dr. MacDonald has led a team of Canadian scientists and engineers from around the world to develop an easy-to-produce ventilator using off-the-shelf, easily accessible parts, and we were able to partner with them, a company called Vexos, in Markham, Ontario, to bring this vision to reality. I'd also like to announce that we have signed 6 new letters of intent to strengthen Canada's domestic testing capacity, a critical tool necessary to getting our economy back to normal. Oakville-based GL Chemtech, Biobasic Canada in Markham, and Edmonton-based Ron Pharmaceutical will be producing key chemical inputs for testing. Galeness Sciences from Montreal, as well as a partnership between McGill University's Centre for Structural Biology and the National Research Council of Canada, are working on producing key inputs and enzymes. Quebec-based Plastics More is retooling to manufacture critical plastic components necessary for COVID testing. And we're also finding, through the NRC Industrial Research Assistance Program, 6 new early-stage tests, some of which will expand Canada's existing capacity to diagnose COVID-19 infection, and others which will be able to detect antibodies in a patient's blood. Artron Bio Research in Burnaby, Custom Biologics in Toronto, and Biolytical Labs in Richmond are developing point-of-care testing kits. As mentioned, Luminultra Technologies in Fredericton are producing lab-based test kits and reagent. 2 companies, London's Diagnostic Biochem Canada and Response Biomedical in Vancouver, are developing serological tests to detect COVID-19 antibodies. And a few weeks ago, as part of our Innovative Solutions Canada Challenge, the NRC asked small and medium-sized businesses to come up with alternative materials that could be used in large quantities to manufacture N95 respirators and surgical masks for healthcare workers. 3 companies were selected from that process: Steadfast from Granby, Roswell Technologies based in Calgary, and Performance Biofilaments in Vancouver. These companies will work on solutions to this challenge using materials sourced and manufactured right here in Canada. And over the past few weeks, we've also leveraged our innovation superclusters by tapping into their national network of over 2,400 members. The NGen Supercluster has been supporting COVID-19 related projects, including one led by Eclipse Automation from Cambridge, which is retrofitting traditional N95 machines to be able to produce new Canadian mask designs with Canadian intellectual property. And the Digital Supercluster has approved a number of projects focused on expanding our ability to detect COVID-19 cases, providing virtual care, and accelerating the development of vaccines and treatments using artificial intelligence. As we work together with the Canadian business community, I have every confidence that we will continue to deliver on breakthrough solutions, retool where we can, and scale up to meet our needs during the crisis in the near future. Thank you very much. Merci beaucoup.
Thank you, Nav. Et maintenant, je donne la parole au président du Conseil du Trésor.
Now the President of the Treasury Board. Thank you, Christia. Good day, everyone. The Prime Minister and my colleagues made some important announcements this morning. The first has to do with Canada's role on the international scene to fight against unemployment and poverty that is created by COVID-19. The second announcement has been made by Ministers Bain and Annan concerning the significant progress that has been made regarding supplies and distribution of medical equipment and personal protection equipment. And we also have some good news, funding of 700 posts for young people in the agro-food sector, and also the federal government having received a request for the extension of the deployment of armed forces in long-term care facilities in Ontario and in Quebec. Thank you. Now we are ready to take your questions.
Minister, so as usual, we're going to start on the phone with 3 questions, then 3 questions from the room, and so on. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur l'étoile 1 sur votre téléphone à clavier. La première question est de Hélène Buzetti du Devoir. La parole est à vous.
Question from Le Devoir. Good day. My question is for you, Madam Freeland. Today, Mr. Trudeau said that the federal government is open to regularizing the situation of some refugees who worked in the long-term care facilities. It's not clear to me. Are we only talking about regularizing asylum seekers who arrived illegally through Roxham or other means, or are we talking about all refugees whose files will be quickly addressed? Could you please clarify that situation? Answer. I will try. As the Prime Minister said, we've always understood the importance of immigration for our country. Our government is open to immigration. Today, we understand that the people of Canada and of Quebec are extremely appreciative of the work that these asylum seekers are doing. And people want to thank those people for the work. We do understand. At the same time, we believe that we need to do things properly. We need to look into how we can do that. Yesterday, I spoke with Minister Medicino, our Minister of Immigration, and as the Prime Minister said, Marco is looking into that issue in close collaboration with Quebec to find out what we can do. Follow-up question. Could you please clarify whether you are talking about people, the irregular asylum seekers who came in through Roxham, or are we talking about all refugees? And could you tell us what you discussed with Premier Legault about that? Could you please repeat the question, the answer in English, and we'll come back to that.
As the Prime Minister said today, Canada is a country built on immigration, and our government is very open towards and welcoming of immigrants. We understand that there is a very specific situation right now where many people in Canada and in Quebec are particularly grateful to the refugee claimants who are doing such important work taking care of our elders. People are grateful. People want to express that gratitude, and we really understand that. We know also that it's very important in all issues, very much including immigration, to do things properly and carefully. Marco Mendicino, our Minister of Immigration, is looking into this issue very carefully and closely, as the Prime Minister said today. Concerning
the other question, the specific issue we believe concerns asylum seekers who are doing absolutely extraordinary and essential work now. That being said, you are right. That's a big question. The Minister of Immigration, just as the Prime Minister said, is looking into the issue. As I said before, we must do it, and we'll do it in close collaboration with Quebec. Thank you, Madam Vice Prime Minister. Operator, next question.
Merci. Thank you. The next question is from Kelsey Johnson from Reuters. Please go ahead. Your line is now open.
Hi there. Thank you for taking my question. My question is for Dr. Tam. Dr. Tam, we are in the middle of a heat wave, and many of the traditional places that vulnerable populations would go to cool off, like swimming pools, splash pads, malls, movie theaters, are all closed to slow the spread of the pandemic. I'm wondering what your advice is to municipalities and other officials who are going to have to find a way to ensure residents can cool down in the next 3 days while ensuring the COVID outbreak doesn't spread.
Yeah, so addressing multiple health issues is obviously going to be a challenge. I think from a public health perspective, we know that is the trying to do this while respecting actual distancing or providing other measures is the key. I think whatever municipalities come up with as individual solutions, like other spaces that could help to be opened up, for example, must still respect the public health measures, and they need a plan in terms of ensuring there are sick people still stay at their residence as much as people can assist with that. And then all the other measures includes the hygienic measures should be in place if people are looking for these solutions. So like any other setting, absolutely plan very quickly with the local public health authorities on how do you maintain physical distancing, potential need for mask use if you can't, hand washing, all of those measures will still apply, unfortunately. So that would be one aspect of it that people have to respect.
Kelsey, follow up?
And just as a follow-up, is there any situation where facilities like a splash pad or a beach or that could be opened up without the risk of scenes like we saw in Toronto with just too many people in one space?
I think with the public health officers that there are ways, particularly outdoors, in minimizing the risk while reducing other negative health impacts. So if you're on a beach, then respecting those physical distancing measures can still be done. More of a challenge, I think, is when people have to use communal sort of environments like washrooms and those kind of services while you're at those outdoor spaces is, I think, where the medical officers are looking at that in particular. So the numbers of people that can be accommodated may not be necessarily, due to the restrictions of that open space, but due to sort of access to these common services. So they will have their specific plans to deal with that. That's actually very detailed planning. So listen to your local public health for sure.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne. La parole est à vous.
Question from La Presse canadienne.
Oui, bonjour. Pour continuer
Hello. To continue in the same vein, my question is for Dr. No or Dr. Tam. There's a heat wave now. Yesterday, we could not give any answer to the fact that the officials of long-term care facilities had to take care of seniors. There was no clear indication. For example, the public health authorities in Quebec. This is my question. What are you recommending that these long-term health care facilities do? How can they deal with the current heat wave? Answer. Thank you for your question. This is Dr. No here. As Dr. Tam already said, yes, we know that's a challenge. According to the public health strategies, we have to make sure that they are still in force. Physical distancing as much as possible, 2 meters. And good hygiene practices like constantly washing our hands. All those measures remain in force. Given the situation of a heat wave, we know it's more difficult. There are still measures that can be taken, for example, using fans to help air circulate. Maybe separating people already contaminated in a long-term care facility, separating them from those who are not ill. If it's possible, it's difficult because each situation in a long-term care facility is unique. We know that it's always better to be outside because with the evidence we've seen, the risk may be higher inside. With the good weather, if possible, people may go into the yard. Maybe the residents may go out in turns while maintaining physical distancing of 2 meters just to get some fresh air outside. Maybe there should be a timetable to make sure that everybody has spent some time outside. I don't know what is possible to make sure that everyone stays well hydrated. Does everyone have enough water to drink? These are principles that are still in force. We know that challenges remain on the ground. Local health authorities and also the officials of the various institutions would have to plan and make sure that they implement the current public health measures according to the context. Follow-up question. To clarify, Dr. No, would you be issuing national recommendations, or is it really up to the local authorities to decide. Local authorities do not have any recommendations to give. They are relying on the institutions. Would you be issuing countrywide recommendations, or will you be leaving it up to the institutions? Answer. It's very concerning. We did not really discuss it in detail with our counterparts of the Special Advisory Group. That may be something we need to discuss in further detail. For as long as we agree on principles, ultimately, it's on the ground that things have to be done at the local level. We know that even before COVID-19, someone like me, I worked at a local level with the heat waves. It's the same principles. People should stay well hydrated. All those measures still apply. The challenge now is how to implement measures for a heat wave, considering the reality of COVID-19. So yes, that's something we could discuss with our counterparts. We don't know what the results of those discussions will be, but ultimately, I think it will be more realistic for local authorities, because they are the ones who know better what is happening on the field than those of us here at the national level.
Turn to the room, starting over there.
Hi, Tom Perry with CBC. It's a question for Minister Hajdu. In regarding this report by the Canadian Forces about the long-term care facilities, I'm just wondering, what specifically can the federal government do right now in conjunction with the Ontario government to improve the situation in these homes and moving ahead, making sure that this doesn't happen again?
Thank you very much for the question. And as you know, since the outbreak of COVID-19, we've been well aware of some of the fragilities in long-term care in the long-term care sector. And as the Prime Minister said, and I have also read the report, it is extremely disturbing. And we will be there for Ontario. And, this, as you know, is a provincial jurisdiction in that they have the direct line of sight into facilities, but that we can be there to support them in making sure that seniors have a dignified life. And as I said earlier, in many remarks, this is not something that I think any Canadian wants to see to continue. So I know that the work will be difficult, but we are committed to being there for provinces, including Ontario.
Can I ask, specifically, though, you say support. Is that money? Is it, what else can you do to try to fix this now?
So thanks for the comment. I think the things that the provinces have indicated they needed help with, we've been there with that help, and that has included, as you know, financial resources, but also people, also expertise in the form of bringing in highly trained military personnel, for whom, by the way, we are extremely grateful for their service and their ability to do so quickly. I think that is a conversation that we will be having with provinces and territories in terms of what support practically will make a difference. And I think Canadians expect us to be there for our elders, and we will work very closely with the provinces and territories to understand how best to do that.
And I'd just like to add one thing, Tom, just following on what Patty has said about the Canadian Armed Forces. I think we are all so grateful to them for their literally life-saving work. And I am really grateful to the people doing this work who had the courage to step forward and write this report. It's really, really important, and it's important to recognize that they did that.
Bonjour, Christian Noël de Radio-Canada. C'est une question sur les équipements
Question from Radio-Canada on personal protection equipment. So anyone can answer in French or in English. When we look at the equipment that was ordered and what we received...
We're going to pull away from this federal briefing now. You can continue watching it on our website, cbc.ca/politics. But I'll bring back my colleagues, Vashi Capellas and the CBC's David Cochran, who both have been doing an excellent job getting information for all of us as we await the official release of this this report written by the Canadian Armed Forces about the situation in long-term care centres in Ontario. It does touch on, as you mentioned there, Vashi, all 5 places where the Canadian Forces have been located for the past couple of weeks, 250 of them, Vashi.
Yes, it does. And as the Prime Minister remarked, and you just heard Health Minister Hadiu as well as Deputy Prime Minister Chrystia Freeland say the results of that, or the content of that report, is very disturbing. A couple of other things that jumped out to me. First of all, I'll just pick up on what we just heard. Our colleague Tom Perry was asking the federal government specifically what they mean when they say we will be there for Ontario. That's what Health Minister Patty Hadiu said. It's also what the Prime Minister said not too long ago. Does that mean extra money? Does that mean additional resources? Does it mean a change in jurisdiction? Anything like that? The health minister indicated that, of course, the provinces have jurisdiction over this. She reiterated that some extra money has already been delivered, as well as resources. I imagine she means there the Canadian Armed Forces. The Deputy Prime Minister called them courageous for coming forward and reporting what they did, the contents of this report. But there was no specific answer on, does this mean, for example, an inquiry? Will it mean extra money? I know that the way it works is that the province asks for the extra help, and then the federal government has to decide whether to do that. We know there has been an ask from both Ontario and Quebec to extend the time the Canadian Armed Forces is spending in these homes, and that request is currently under consideration. But I did find that line of questioning very interesting, and I think it will be of increased importance when the public sees the contents of this report, when we hear from the Premier. Maybe the Premier will have something specific that he needs from the federal government to address that. But based on what I've heard so far, there is an ask in this report, there is an ask of the military that the provincial government do something, investigate and do something about this. And to that end, and I know David has more information on this, my sources in the military have told me that there is also a forthcoming report on the situation in long-term care in Quebec as well. This one, of course, is focused on Ontario, the 5 homes that the military is helping out in Ontario. But my understanding is there is something coming on Quebec as well, and I know David has more on that.
Yeah, and David, why don't you pick up there?
Yeah, it's not much in the way of specifics, but Rosie, I can tell you that when the Ontario report was delivered to the Prime Minister's office, senior officials were told that there was another one coming, and this one would be on Quebec. Now, a little bit of context there. The military is helping in 25 long-term care homes in Quebec, only 5 in Ontario. Obviously, if things were running great in Quebec, you wouldn't have the military in 25 of these homes. But in terms of a question of degree, apparently what was witnessed in Ontario was of a more severe nature, is the understanding that the senior government officials we're speaking with have of the situation. But there is another finding from the military of some sort expected to be delivered to the government as to what is happening in Quebec. And this does raise a lot of these questions of how do you fix this going forward, right? Because these issues are in Quebec's jurisdiction. They are in Ontario's jurisdiction. But Rosie, this is a national shame. And there will be a call for national action on this even before the dust settles, because as we hear every day from public health officials, we are bracing for the possibility of a second wave in the fall. And you cannot go into the traditional influenza season compounded by the risks of the COVID-19 pandemic without addressing the systemic failures that exist in the long-term care system in the country. So this report that the Premier will release in about 30-35 minutes is going to be quite shocking and explosive for people to see based on the information that we have been provided, and perhaps a less disturbing sequel to come on the findings of what has happened in Quebec as well.
Just a reminder that for people who live in long-term care centers, it's more than 70. I think we're almost verging on 80% of the deaths in Canada due to COVID-19. Quebec accounts for more than half of those cases, almost 60% of the deaths. So a couple other points in Quebec. I mentioned the case of the Heron long-term care center. I should also mention now that police and the coroner are investigating what happened at that facility. So we do know that there are police investigations that have begun in Quebec. In that case, there were more than 31 deaths in a month, not all of them due to COVID, according to initial reports anyway. And we also know that when Ontario announced that independent commission last week, they pointed out that 1,400 people had died, including 5 staff at long-term care centers. The difference, I guess, between an independent commission and an inquiry would be a legal one, undoubtedly, in terms of the consequences of it. But it does sound, from what what you've both said about what the Canadian forces have seen and what they are reporting back, and the way the report seems to be written, that this may require more immediate action rather than a commission or inquiry. It may actually have to involve some legal authorities to try and get a handle on things. And I should say, we know from past reporting that, this isn't an issue necessarily of blame. It could be lots of things, right? In terms of the workers not being well equipped, fearful of losing their jobs, not being well trained. It could be many things at play here. And that report certainly will give us a better sense of that. I'll just get a couple more comments from both of you, Vashi.
I was just going to say, as you listed that out, I was reminded of the Elizabeth Wettlaufer inquiry, right? Which very much looked at some issues which are very similar to what we have been discussing and what is laid out by the Canadian Armed Forces. In fact, many of the conclusions reached already by people who work in the system, such as inadequate staffing, staff who are paid too little, shift problems, people working in more than one home. All of those issues which have been identified in this pandemic were actually identified in that inquiry as well. And in fact, the provincial government was due to respond to the recommendations of that inquiry in July. So it brings to mind kind of, I think there is an accountability aspect of all of this, and I wonder if it informs the response today insofar as there are all these calls for inquiries, and certainly they have to happen, but there have been a lot of investigations into the issues that plague the long-term care system across the country, but specifically in Ontario in this case. And there are already recommendations and conclusions that have been reached. Yeah. So there probably are things the province could do today that would make an impact. And I know some things have already been done, some changes have already been undertaken, but there is already a body of research, a body of work that has been completed that they could act on immediately, and I'd imagine those questions will be put to the Premier.
Yeah, there were some of those recommendations came even out of the SARS pandemic too. So David, I have 30 seconds to you.
Yeah, the expectation at the federal government level is that this report will be referred to the coroner in Ontario by Ontario Premier Doug Ford. Global News is already reporting that that will be the case, so that will lead to some sort of formal inquiry. There will be a lot of conversations about jurisdiction and responsibility, but the findings, essentially as we know them, is that seniors were allowed to sit in their filth, surrounded by flies and cockroaches and rotting food. I'm not sure Canadians will tolerate a debate over jurisdiction. They'll want to hear about solutions.
Okay, thank you both very much for your excellent reporting throughout this. I appreciate it. Vashi Kapelis and the CBC's David Cochrane. We will leave our coverage there, but obviously we will keep tracking this important story throughout the afternoon with Andrew Nichols. I'll see you back here tomorrow. Thank you for watching CBC News Network. I'm Rosemary Barton.